It's lovely to be here today to talk about a service that I developed over a number of years in my advanced practice journey. So the title of my presentation is Innovations in Dementia Care, a novel approach for patients and families in a changing landscape. So Féileacán represents hope and transformation. It's important to say at this point that everything about Féileacán is patient and family focused. And the reason that I use the term patient, and you'll hear that throughout my presentation, is I put it back to the people that attend the service. And I ask them, when I'm not calling them by name, what do they wish to be called? And they chose to be called patient. So that's why I will use that term. So hope is that life is not over at point of diagnosis, as so many of them believe it to be, and transformation meaning that they will adapt as their needs change, and this will be supported by Féileacán. So the service ethos, again developed by the First Lived group in 2021, is forget me not, for I am still me, and every day is a journey, my journey. So while I started this journey in 2017, the broader scoping happened back in 2016. So I looked across at the international evidence, and this is what I found. So across the world, we've over 55 million people living with dementia. We know that it's the 7th leading cause of death, and it's a major cause of disability. And we've over 10 million diagnoses each year. So bringing it back nationally to the Republic of Ireland, we've a population of over 5 million. And of this, 64,000 people are living with dementia. But it's very safe to say that these are the ones that have received a formal diagnosis. And anyone working across the landscapes of healthcare would know that there's many people out there that are on the pathway to diagnosis, but that don't have an official diagnosis. So there's many that need our support. And the 64,000 then further breaks down to 30 diagnoses each day. And as we all know, that is set to increase as our population ages. So then coming back to my practice area of Dublin, South Kildare and West Wicklow, we have a population of over 75,500, and 4% of these are living with dementia. So that was the evidence that I got. So then I did my own scoping review, and to me, this is the real hard evidence. So I looked at patients, and they told me that they were devastated, they were lonely, they were fearful, they were ashamed and embarrassed after receiving the diagnosis. There was huge societal stigma perceived by them following their diagnosis, which really socially isolated them. They had difficulty finding and navigating services. For family care partners, and this could be husband, wife, daughter, son, sibling, anyone that was supporting the person, they felt, and I still hear it today, that they have no voice and nowhere to turn. They felt isolated, lonely and despair, and they had no support or limited or no educational opportunities. So then I looked at staff across the landscapes, because they were important, especially that the service moves across the community. So I was looking at the public health nursing. And what they told me was that they had no training in the area, and their roles were very generalist. So they felt they had very little to offer a person living with dementia. And then for the existing services, there was huge pressure and increasing diagnosis with an increasing burden. And what remained was the status quo. And we were expecting people to fit into this status quo, which didn't meet their need. And this is, I suppose, the pinnacle of it all, and what really drove me to continue developing pathways that eventually led to the service Féileacán, which was the patient voice. So when I started out on one pathway, I asked patients attending, could they give me one word or two of how they felt when they first heard their diagnosis? And this is what they told me. They felt stupid, ashamed, broken, dehumanized. They're real people. So one person at point of diagnosis told me, when I was told I felt dehumanized, I don't want it, people will think I'm an idiot. Since connection with Féileacán, life is not over as I thought, it's just different. And that was enough to drive me to continue to listen to the voices of patients and families and design the pathways in a way that wasn't connected to the status quo, but that actually met their need. So then I began building Féileacán, and what did I need? I needed knowledge. I needed knowledge, obviously, of the area of dementia for all stages of this journey. I needed knowledge of the landscapes and the services that were out there. And I needed this knowledge to bridge together all of this to provide me with a care integration network, which I'll talk about in a moment. I obviously needed to be motivated, and that I got from listening to the patient voice. I needed leadership, I needed autonomy, and I needed commitment. And most of all, I needed people, and I needed their voice. I also needed support. So when I started out on the journey, I had a steering group. And then once the service was developed, that soon moved to an expert advisory group, which is still in place today. People that sit in that group are from national level, and they're very important to me because they are the people that hold the purse strings. So when I come up with a new element to add to a pathway, I will get support from them to deliver on that. I also needed a care integration network, which I will show you in a slide in a moment. It's a very busy slide, but I think it's important to show you that it's not just me and now the growing team, that it's all these people are behind, if you like, to support the person living at home in the community, and every single person that's listed on it is essential. And I also needed pathway partnerships. So it's all very fine that I look after the person from point of diagnosis and throughout the journey. And yes, you know, I can take them on board when they're acutely unwell. But there does come times where I have reached all I can do. So I need support and risk reduction pathways back into the acute setting. And that was the importance of building these pathway partnerships to facilitate that risk reduction if I needed it. So that was building my house. So Féileacán is a nursing service model developed to deliver care and support from point of diagnosis and throughout the journey to both patients and families in one community service. I asked one of the family care partners, had she anything to add when I was talking about this presentation. And what she asked me to voice was that the uniqueness of Féileacán is that we know the family care partners just as well as we know the patients, because we provide a service for them also. Okay, so Féileacán as it stands today consists of 5 multi-element pathways, which you can see there. Each pathway has multi-elements to it. In my advanced practice, I'm required to complete a full episode of care. The research then will tell me that a person living with dementia requires consistency and continuity of care and support. So now I was faced with how am I going to meet both of these areas? So the service design was really important in this. So what I came up with was, if a patient came in to me on a particular pathway, and say, for instance, the Live-Dem pathway, and when they come in, they were unwell, acutely unwell, and they weren't ready to start that. So to complete my full episode of care, obviously I did the assessment and intervention with the patient. I discharged them off that pathway. That is my full episode of care completed, and I admitted them onto another. So I'm providing the consistency and continuity, and that is how these service pathways work. So within each service pathway, you have a referral. I started off very small. I would have one referral stream in for one pathway. Now all of the pathways have multiple referral sources, which is the way it should be. There's an intervention period for each pathway, and that differs. There's much collaboration. And what was new then, we initiated at the early part of the journey, advanced planning. And that was an important aspect to add into the service, because we were getting to know patients and family members really, really well. And we developed, you know, a trust relationship. So the advanced planning is working really well. We have used it, we have presented it when they have gone into palliative or they may have gone into long-term care. So it does follow them through. And if anyone hasn't initiated advanced planning and have that opportunity, while some of the discussions, you know, they're not easy discussions, it's well worth doing it when you have developed that relationship with the person. And then there's discharge and follow-up. And as I said, it's only discharge from that particular pathway. They are admitted onto another. So pathway elements, I just put this slide together just to kind of give you just a brief idea of what's within the pathways. So obviously a full episode of care, there's assessment, intervention, monitoring and follow-up. There's symptom management, there's education, advice and support. There's post-diagnostic clinics, so there's assessment clinics, non-cognitive symptom clinics, brain health and advanced planning. There's community intervention. So what we identified was there was particular areas within our practice area that we were getting a lot of referrals in, but we were getting non-attendances. And when we looked at it, people didn't have travel to get them into an appointment. So what we did was we opened an outreach clinic in the local health centre in that area. And what I can say is that clinic is full every single week. So we brought the service to them. We do home visits, video-enabled care and crisis intervention. So for peer support, we have 3 carer support network groups that run fortnightly, and they cater for different stages of the journey. We have a writing group, and again, I'll talk about that in a moment, and we have a memory lounge. So we recently, last October, opened a community cafe, and I think we're the only cafe, correct me if I'm wrong, that operates on a Saturday. Because when we reached out to the community, they told us they had nothing to do at the weekend, and typically services were closed, from Friday. They closed up on a Friday till a Monday. And also, really good news, as of last week, the service has gone 7 over 7. Because as we know, dementia does not stop on a Friday. People need support when they need it. So we're available over the 7 days. And we have a bespoke brain gym home program. We have family support meetings, and we have clinic appointments and education for the family member themselves. And we can do that individual or in a group of family members. So this is a busy slide. I'm not sure if any of you have received a copy of the service book outside. It is out there. I'm going to very quickly go through this. I am conscious that it's busy, but I just wanted to give you an idea of how robust the pathways are and how that we can provide the care and support for somebody as they go along their journey. So this is the Live Dem roadmap. This was the 5th and final pathway. When 4 pathways were up and running and very embedded, I sat back and I looked at the service design, and what I figured, or what was, I suppose, jumping out at me was there was nothing for people at point of diagnosis. And when I looked at that, the perception out there was that people didn't need support. They were still driving, they were still, going out day to day. But how wrong that was. Why was nobody sitting down with these people following such a life-changing diagnosis and breaking it down with them, what it meant to them? So I scoped across Ireland, I couldn't find anything. So I reached out to a professor of dementia research in the University of the West of England, and I secured the Live Dem programme from him, which is in operation, I think, about 15 years in the UK. Now, it's very different to what they deliver because I got the intellectual property permissions to adapt it and change it to the Irish context. And that's how this pathway started off. So as I said, it was the final pathway and it was the end of 2021. The referrals typically come in from the memory clinic in the acute settings. They can come from anywhere, but we typically like to get people, quite soon after they're diagnosed. We bring them in, we do a very comprehensive assessment. We look at a lot of psychology measures, self-esteem, and their readiness to complete a programme such as Live Dem, because not everyone is ready to sit down and talk about what the diagnosis means to them. So when all that is done, with their consent, they're admitted to the Live Dem pathway. They come in and they do a 4-week in a very small group of 6 people in total programme, which runs over 4 weeks. And parallel to that, there's a carer support group. With permission from the patient, we give general feedback at the carer support group. And that gives them bigger insight in how they can support and not do for the person, because what we don't want is de-skilling. So then when the programme is over, we bring them back in, we do all the same testing again, and that's our outcomes. And we look at, what we need to do then for the patient. Again, we discovered that after the programme and the post-programme assessment, the carers come in every 2 weeks to a carer support network group. And while we get feedback on how the person is doing, we thought, gosh, there's nothing there for the person. So we've brought them in, they've literally done like a 6 to 8 week intervention and then nothing. So what we come up with the idea of a memory lounge. So that runs once a month. It's a 3-hour intervention. We look at CST, brain health. I've roped in the physiotherapist to do a gait balance activity, and that absolutely took off from day one. So we have 20 plus patients that come into that once a month. What I will say is it defies all the research when they say that a person living with dementia shouldn't go into a large group, because they absolutely love it. So that's been running a couple of years now, and it's great just to see the reactions and the interactions throughout it. But again, sat back and looked at it and thought, gosh, once a month is not enough. But obviously we've lots of other clinics, so we can't do it more than once a month. So I came up with the idea of a mini memory lounge, which is the bespoke brain gym home program. So I put in a proposal for therapeutic healthcare assistants, which were given, and they were trained up, and they deliver that program in the person's home on a 1-to-1, and they get 2 calls a week over a 6-week period. Then there's a short gap and they're back again, and that's running really well. I connect them then to community links, and I typically make the first call because people are too overwhelmed. They've got too many leaflets, they're coming out of every press, and they don't know where they should go next. So after we've done the life story work with them and the advanced planning, we know their interests, and we make the first contact with the community to link them to that. What I will say is the patient can move across and back pathways as their needs changed, and then should a crisis occur, and this isn't just for LIVD-M, it's for any pathway. Typically we'd get a call in. If we're in clinic, we can't get out to them. So what we do is we use video-enabled care. We get a good look at the person. We see, are they okay to wait until we can get out later that day? Do they need a GP if we can't get out, or do they need acute care? If they need acute care, I've pathways back in. We will avoid the ED if we can. If we can't, we'll make direct contact with the ED and give the handover there. But they will be fast-tracked through the ED. So it is really useful having those pathways. This is the very busy slide, but this is fundamental to the support provided by Féileacán. I would say if I was to look at this and go through all that's listed on it, there's probably a lot missing that it needs to be updated, because the networking never stops. And after yesterday, thanks to Kim and her team, I've lots more to add from here with another project in the horizon. So delighted with that. And it's really important. Yes, it's a tedious piece because you will get closed doors and you do have to keep going back with a different approach, but it's well worth it in the end, because then you can wrap care and support around that person to keep them at home, which is where they want to be. So the team, as I said, I started out myself. I developed the service up to 2022. And then the team started growing. So I got my first therapeutic healthcare assistant. Then I got full-time admin staff. Then I was invited into the Department of Health to present the service. And what came out of that was funding for a candidate advanced nurse practitioner. And that is Shafali, who's here with me today. So that's amazing. And she's just finished her training now. And I've got a second healthcare assistant. In the middle of doing a service level agreement, because we're actually getting a staff nurse in the coming weeks with the defined career pathway. So that's really good also. We take student nurses, we take nurses that are on the PHN programme. We take volunteers obviously in for the cafe. And what I don't have here is we take a fellow from the Global Brain Health in Trinity College Dublin. So every turnover we take a fellow every week. And while people might say, is that work? It's not. There's huge learning, because we get to find out what they do in their countries as well. And it's not necessarily, just the assessment piece. It could be a music piece. So it's a wealth of knowledge for us. So it's well worth it. So as I said earlier, the service itself is guided by an expert advisory group and documents such as service level agreements and memorandum of understanding. And that's between services and settings. So it's from acute to voluntary to community services. And that's important that we have that in writing. So then, I suppose some of the outcomes, we see an approximate 250 patients per year. We have over 100 attending each month. As you can see, the outcome measures there, which are really important for a person to live really well in the community, are confidence, mood, and quality of life. And the other one, which is typically seen at different points throughout the journey, is anxiety, and that is down. So this was post-connection with Féileacán Bán, and if you look at the word cloud there, it's very different to the first one I showed you. So that's the success. But the ultimate achievement of Féileacán Bán is for us to be able to deliver on what matters. So that's what matters to the person living with dementia and to their family who are supporting them. I love this photo and I decided to show it to you here today. This is the original Live Dem group care partners that started in 2021. And this is just some feedback from them. Féileacán Bán has given them hope. It's reduced the loneliness and taught them how to laugh again. It's like family. It's given them trust. It has given me a lifeline. I feel heard. It's given strength. It's given me purpose. I no longer dread getting up each day, and it's given connection, care and support for both of us, which is invaluable as we go along this way. And that's just general service. So this is a message from Brian and Una, who I'm privileged to have met all my patients and family, and I'm very privileged that they give me the feedback to work and build Féileacán Bán more. So this is a message from Brian and Una. Féileacán Bán has become one of the most important things in our lives. We'll be eternally grateful to be a part of it. It's like a lifeline has been thrown at us. It's a one-stop shop. And I suppose the moral behind showing that to you is just to encourage people to reach out for support, because there is support there. This I won't bore you with, but the presentation I'm sure will be available. This is how I measure quality service. So obviously I need to look at all outcomes. I need to look at my employer, the health service executive. I need to look at my registration, NIMBY. There's Féileacán Bán outcomes, but most importantly is the patient and family care partner, because we need to continue to be dynamic to change the service and adapt it as the patient and family's needs change. Briefly, I'll tell you about the book. So family care partners kept telling me that their voices were very unheard, and this kept coming back time and time again. So I tried to think of ideas of how I could facilitate them in allowing their voices to be heard. So I submitted for a clinical bursary award and was successful. And we developed a book. So it's a service book capturing the lived experience of the dementia journey through the eyes of the family care partners. And this they found really therapeutic. So it was a very useful exercise with them, but it also gave me such an opportunity to work in a very different way with them. There's free copies available out in the hall there. So just a closing message. Féileacán Bán has travelled a very eventful journey, and we continue to evolve and grow alongside all of the people and families we support. We believe that meaningful care begins with listening, not just to the words, but to the needs, emotions, and the unspoken language of connection. As each person's journey is very different, we have remained committed to evolving with the person, never ahead of them and never behind. To truly change how we care, it meant tailoring support and adapting our approaches, environments, and expectations to meet people where they are today, tomorrow, and into the future. At Féileacán Bán, we reimagined what care looked like, not as a service, but as a relationship driven by care, compassion, and commitment, which is embedded in dignity, presence, and mutual respect. Together, we can build communities that don't just accommodate change, but that are shaped by it, where compassion is active, inclusion is intentional, and no one is left behind. And the biggest message is, if I can change the HSE and the status quo, anyone can do it. And that's what we need to continue to strive for. Thank you.